Well, hello and welcome to the San Angelo Live studio. I'm Manny Diaz. Today, we bring you a special edition of Ask San Angelo Live with our very own Tom Green County Health Authority, Dr. James Vredis. Dr. Vredis, it's we were just chatting before the segment here, and it's almost like I've got to start sending out some just random texts to how you doing. Thank you for all that you do, because it feels like the last time, the times we've spoke is we're talking about just uptick in COVID and various things like that. So thank you so much for being a part of this and just having a chat with us. All right, first and foremost, today 188 new positive COVID cases, 505 active cases, 20 currently hospitalized. Thank goodness, thank God, 0 deaths thus far. If you can, tell us, your boots on the ground, you're in the ER. What are you seeing as far as this new COVID variant? Has it made its way to San Angelo?
Yes, it's made its way to San Angelo. We're seeing a huge increase in the number of COVID cases coming through the emergency department. Mm-hmm. We're obviously seeing an uptick in the number of admissions. 20 admitted patients isn't a large number compared to what we had in the first and second humps, but we're real early into this Omicron disease.
To kind of just shed a little bit more light on some more data, when we look at the quote unquote the sick map, the map of Texas as far as the Department of Health and Safety and things like that, we are trauma section K, which is kind of the representative area of the Concho Valley. We're at a 2.06 hospitalization rate. Now we've seen areas of A, B, and I, which is the Panhandle, Lubbock, and El Paso. The Panhandle is at 17.59%. Lubbock area is 17.01%. The El Paso area is 11.36 hospitalization rate. These are the three biggest hospitalization rates in Texas. What do you make of that?
Our time's coming. I mean, we lag behind these other cities and other areas because we don't have an interstate, so we don't get that big blast right when the disease first comes out. Mm-hmm. But on all the other bumps, we've been 4 to 6 weeks behind them, so we're probably going to be 4 to 6 weeks behind. If we look at Omicron around the country, it has a doubling time anywhere from 1.5 to 3 days. So we could quite honestly, by the end of the week, be seeing much larger numbers. Yeah. If you look at from when somebody tests positive for disease to when they get hospitalized, there's normally a lag time of anywhere 1.5 to 2 weeks from when they get the disease to before they're sick enough to actually get hospitalized. And then the ones that are hospitalized, there's anywhere 2 to 4 week period before they're in ICU and we have fatalities. So we're way early in this. We can't tell what's going to be happening.
Okay. Well, according to studies, the Omicron variant will likely spread more easily than the SARS-CoV-2 virus. And how easily Omicron spreads compared to Delta remains unknown. CDC expects that anyone with an Omicron infection can spread the virus to others even if they are vaccinated or don't have symptoms. Tell me, how are medical professionals like yourself, how are they determining if one has Omicron?
Well, right now we can send off sequencing of somebody that tests positive for COVID. We can send it up to the state lab in Lubbock, and 2 to 3 weeks later, we get something saying somebody tested positive for Omicron. There's no way that I could test any one individual and say, I just tested you, you're positive for Omicron. I could just say you're positive for COVID-19. We don't know. Mm-hmm. There's that lag.
As far as symptoms, I know it seems like the common cold almost because we're.
But if you look at it, that's where the original wild strain was. Most of the people were either asymptomatic or they had very mild symptoms. So this isn't a whole lot different from that.
I got you. Now, go ahead and just lay it down. Give us the symptoms of what you're seeing with this new variant here.
Well, the same things we saw with the old variant. People have malaise, they get upper respiratory symptoms, snotty nose, sore throat, cough. I haven't seen that many people that have lost their sense of smell or taste. We're not seeing as much nausea, vomiting, diarrhea as we did with the Delta, because a lot of the Delta had kind of like a Delta gastroenteritis.
Gotcha.
This is more upper respiratory, really a lot of sore throat, sinus, and stuff like that.
Right. Allergy season in Texas feels like
it's really hard to tell. Allergies, we normally think you're going to have sneezing, itchy eyes and stuff. An infection like Omicron or any cold virus, any of the other viruses going around, you expect you to have more fever, aches and pains.
Yeah. All right. Well, according to The Hill, infusion centers in Austin, El Paso, Fort Worth, San Antonio, and the Woodlands have gone through their supply of sotrimavab, the only antibody believed to be effective against the Omicron variant. Texas Health and Human Services said on Monday. The agency said infusion centers in Texas will be unable to offer the treatment until federal authorities ship additional courses of sotrimavab to Texas in January. How crucial is this thing if there isn't anything to truly treat it right now?
It's really sad that we don't have a good treatment for it. I think last I heard we just have a few doses left at Shannon that we're saving for the people that need it the most. Aside from that, it's going to be supportive care like you do with any other viral illness.
Mm-hmm. I guess so. Without this sotrimavab we were hearing and I think the last time we spoke it was bamlanivimab, what Donald Trump was treated with. Is that still in use at this time?
No, it hasn't been shown to work at all with the Omicron variant. So that's how come we're down to just one. We used to have 4 different monoclonal antibodies to choose from. Now we're at one, and that one just about doesn't exist.
Now we said, I think you had said it last time. It was almost. Vitamins. The simple gummy chew. A vitamin is just to kind of just.
Yeah, the simple things. Stay away from sick people. If you're sick, stay away from other people. Wash your hands. Wear a mask. It doesn't look like the vaccinations are working out real well against Omicron. Even people that have had the booster, after 10 to 12 weeks after having had a booster, if you actually look at their antibodies, they've plummeted. We don't really know how their T cell activation is, but just when they do the studies trying to figure out is this going to work, it doesn't look like it works real well. Mm-hmm. And that's how come Israel has just approved a second booster or 4th shot for people over 60 for Omicron.
Wow, 4th booster.
Well, it's the 4th shot. So
the 4th shot, okay,
booster,
yeah. Man, okay. So I guess before we get into that, and this thing is originated from South Africa, and the South African National Institute for Communicable Diseases has said a lot on this. 80% reduced chance of being admitted to the hospital than Delta. Omicron sufferers were also 70% less likely to be admitted to an ICU or put on a ventilator compared to those with Delta. And this is all according to the South Africa's National Institute for Communicable Diseases. It doesn't seem it is as dangerous as Delta, but it is more, you're more susceptible to get it.
It looks like it's spreading faster, but each individual has a lower chance of being admitted to the hospital or being admitted to intensive care, which sounds really good. You're less likely to get really sick. Mm-hmm. But if you have 8 times the number of people getting the disease, that still adds up to a whole lot of people in the hospital.
Now, I think, natural immunity has kind of been something that's been tossed around over there in South Africa, because I believe there's, 30% people that have actually been vaccinated over there, but more people are recovering from this and at a higher rate. I guess, how do you explain, is that anything for medical professionals to really look at over there and maybe see, okay, what can we take from that portion of the world and bring it over here?
Well, I'm not suggesting that we would have Omicron parties or
exactly.
Yeah, well, that's not a great idea. If you look at our population, we're definitely a different population than in sub-Saharan Africa.
Mm-hmm.
It's just different population, different eugenics, genetics as well. You can't just take and say this is what they do over there. It's going to be the same over here.
Okay.
It'd be great if people got immunity with it, but there's a lot of sick people around the world that have been vaccinated. There's sick people that have had previous, either the wild strain or Delta, who are getting Omicron.
Okay. Well, I guess the survival rate of that, or not being hospitalized, does that make you, when we start throwing around that 70% of something, mm-hmm. Should that make people feel a little bit better with this thing kind of just circulating around Omicron, and that you're not likely to kind of be put into the hospital with this?
I think I would rather have Omicron than Delta, but I'd rather.
I know. Let's pick and choose our diseases here.
Yeah. So I could see that Omicron appears as it'll be better than having had Delta. But again, we've just got it in the States recently. We don't really know how we're going to do with it.
Okay. Emerald Robinson of The Right Way, by comparison of Iceland and Portugal, both countries have over 75% of their population fully vaccinated, and more have COVID cases per 1 million, more than countries such as Vietnam and South Africa that have around 10% of the population fully vaccinated. According to Robinson's article, it's like the more people get vaccinated, the higher the cases of COVID. Is that anything? I mean, as far as like people that are getting COVID right now and that have already been vaccinated, I mean, because people were lining up to get this thing so they wouldn't get it. Yeah. I guess your thoughts on that.
Well, if are you trying to say getting vaccinated leads to getting COVID? No,
sure. I mean, is there anything involved in that?
These other places that have really low vaccination rates and they have low COVID rates. Mm-hmm. Those are also the same places where you're not likely to get a lot of COVID testing. So if most of your population doesn't get tested for COVID, you don't really know what your real rate is throughout the country.
Well, I think, President Biden, he's kind of really pushing for more testing. Mm-hmm. Is that... I mean, from your perspective, seeing a lot of these COVID patients, seeing people should we be? Is that kind of something on the line that we should really be looking at more than anything else? Maybe ahead of these antibodies that are helping people.
I mean, there's actually a point to be made to having the ability to do rapid tests at home, because even though the rapid test and the antigen tests are not as accurate as the PCR test, they do say that if your antigen test is positive, that means you actually have the viral particles there. If these home tests aren't as specific or as sensitive as the ones we do in the hospital, they're still probably sensitive enough to know whether you're infectious. And if, the difference is, do you have the disease, or do you have the disease and can you infect people? If you have the disease and you can't infect people, go about your daily life. I mean, wear a mask, but go around your daily life. On the other hand, if you're infectious, you probably ought to stay home. Mm-hmm. If you test positive, rather than keep your entire family in quarantine, it'd be nice if you just swab everybody's nose. Oh, they're good to go. They don't have enough viral particles to be infectious. They could go to school. They could go to work. This way we don't close down the economy, because, a large part of public health is also mental health, which means we got to have financial health. We can't shut the country down every time a disease comes. We need to look at what's a better way for us to say, you can't work or you can work. And daily testing would be a great way to do that.
That's a great thing. We've got to learn how to live with this.
Yes. And be the safest for everybody. I want you to be able to work. I want me to be able to go to work. I don't think you should go to work if you could get Joe sick. On the other hand, if you're not going to spread the disease, you should be able to go to work.
I'm with you on that, yeah. The CDC, they're shortening the recommended time for isolation from 10 days for people with COVID-19 to 5 days if asymptomatic, followed by 5 days of wearing a mask when around others. Evaluate that move. I mean, was this? Certainly because we're having this Omicron variant kind of being circulated around. Was this a good move at that point?
Yeah, I think it probably is, because again, what they're trying to do is they're saying you're most infective 2 days before and 3 days after you develop symptoms. So if we could keep you out of the public so you don't spread the disease when you're the most infective, and if you're not having a lot of bad symptoms, wear a mask and you go on. Because you got to remember that, when I put on a surgical mask, it's not to protect me from you. It's to protect you from me. It's so I don't spread the disease to you. Mm-hmm. So all these surgical masks, they're to protect everybody around the person wearing the mask. Yeah. If you're still wearing a cloth mask, you probably ought to get rid of it and come up with a real surgical mask. N95 masks are available. When we first started, we told people don't get N95s because we need them at the hospital, and we did. But now the supply is good enough that everybody can go out. They can get an N95, or they can get a real surgical mask, a real 3-layer mask, something that actually stops the spread of disease. But you don't take home, throw on the counter, put back on the same thing after it's been all crumpled up.
Sure.
So the inside and outside have been touching each other.
So the bougie sequenced cloth mask, those really aren't doing much for anybody.
No, I don't even think they look that good.
All right. I think you had shed a little bit of light on that. So with this third shot, this booster, how it doesn't seem that it's been that effective on this new variant. I guess if you can, I mean, what's for people that are, I mean, it feels like, our government is encouraging more people to get more vaccinated, but I guess seeing that the booster is really not doing much with that. I mean, what's the carrot at the end of the stick here for the people that are trying to get vaccinated, or that are being encouraged to being vaccinated with this, if there's not something yet that can really defeat that?
Well, it looks like if you've been fully vaccinated, 2 shots, and then get a booster, you're probably immune to Omicron for somewhere in that 12-week range. So that's reason to get it. And like I said earlier, Israel has just approved this 4th shot. Mm-hmm. So it may be that we need to get a 4th shot. And what we really need is for the companies that make these vaccines to come up with a better vaccine, something that's works on more different strains.
Sure.
Walter Reed actually had an article out couple days ago that they've got one that looks like it'll work on all strains. So
okay,
it's done. They've done the animal trials. They're getting ready to do human trials, and we've been talking about getting a universal flu vaccine, so you don't have to get a flu shot every year. There's no reason that we shouldn't have a universal flu shot and have a universal COVID shot.
I gotcha.
Just get rid of this disease. I mean, yes, we needed warp speed. We needed to stop the first wave when it came, but now we need to look at what's our long-term plan.
Right.
And our long-term plan is come out with a better vaccine.
And I think that's what a lot of people are waiting on, is just because, I mean, how many jabs are you going to take within, a 6 month span?
Does a jab hurt you that bad?
It doesn't hurt me that bad. And okay, I'll say I'm a vaccinated person, but I mean, at the end of the day, it's like, I mean, gosh, I got vaccinated back in, when was it, April?
Sure.
And so, I mean, I'm not trying to get poked every 3 months,
But it does look like it helps, again, within that first 12 weeks, the booster helps. Obviously, if you had it, the 4th shot, it would probably help you longer. I mean, we've done this with multiple other vaccines. We've required boosters, and sometimes we've changed the rate that you get boosters. And so, I think that's where we're at now. I would love to see us have a better vaccine, but we don't have it now. So, the best I could offer people is the best I can offer.
I got you. So, well, and also kind of, I guess just advancing that. So for younger people, I mean, I know the booster is more encouraged for middle-aged folks in that particular age range there, but for younger folks, 20s and 30s, that live that active lifestyle, that stay pretty healthy, I mean, is that still a suggested thing for them as well?
Yeah, it is. It's the best we have to offer right now. You got to remember, we don't have monoclonal antibodies to offer you when you get sick. This is the best we have to offer. Is it ideal? Not even close, but it's still the best we have.
Just a few more things before we let you go, and I think this has been a big one. And this was announced today. Starting January 10th of next year, Rice University has announced that it will hold classes online for 2 weeks, require COVID booster shots for all employees and students. Is this move jumping the gun, or is it just taking that extra precaution?
I think it's taking precaution. I don't know if it's an extra precaution. It's a pretty reasonable way to be able to keep their university, to have students and have faculty.
Mm-hmm.
I think it's a good idea to require boosters.
I gotcha. Yeah, I mean that's just a few more weeks away for some of those.
Is, but it's not a surprise to anybody that boosters are going to be coming. I mean, we require people to get a lot of other immunizations to go to school, and they have to have their meningitis shot. What the odds of you getting meningitis is actually really, really, really slim. Mm-hmm. The odds of you getting COVID and the odds of you having a bad COVID disease are much higher than the odds of you going to get a bacterial meningitis.
Gotcha.
You still need the meningitis shot.
Absolutely. No, without question.
But I mean, if you look at the odds, this is going to make a bigger difference as far as the health of their students and faculty than some of the other immunizations that we require, and we have no problem requiring.
Mm-hmm. No, I'm with you on that. Now, there's a lot of media outlets out there nationwide. I mean, I feel like some of them are out there just to scare people with all this data. They just throw it out to mind dump of data that just scares the hell out of people. Long story short, I mean, how much do we need to, I mean, obviously we need to pay attention to that stuff, but how much do we need to go about and just live our daily lives?
I think we need to live our daily lives. You cannot hide from this disease. Smart things, same thing. Wash your hands. Don't go around sick people. If you're sick, don't go around other people. I'm amazed by how many people come in the emergency department and I say, where did you get this? Oh, I was with my friend. Who's got it? And your friend have it, and you go hang out with your friend. Odds are you're going to get sick. Common sense.
Yeah, makes sense. Common sense. And I think that's
which is so rare.
And I think that's what
it's like a superpower nowadays.
A superpower. Yeah, that's common sense. Who would have thought that? I guess more importantly, I guess just to get away from that whole scare tactic. I mean, I feel like that is a scare tactic. I mean, that's for me, for myself. I don't turn on the whole lot of the national news because I read it all damn day, and I'm just like, oh my gosh, mind blown at that point. But more importantly, we just got to live our daily lives, as the good doctor says here. Man, anything else that you maybe want to share with the folks here in San Angelo and the Concho Valley?
No, I mean, don't be surprised if we get worse. Our numbers can go up tremendously, which doesn't mean necessarily that we're doing anything wrong. It just means that we're behind, time-wise. We don't get our peaks the same time that El Paso and Lubbock gets their peaks. So, San Antonio's had a huge increase. They just announced today. So.
And
we're going to have it.
And if somebody does have some of these symptoms, best case thing to do when that happens.
Yeah. Get tested if you're positive. Stay away from other people. If you get COVID and you're feeling real short of breath, get a pulse oximeter, check and see what your oxygen level is. If your oxygen level is below 90, you probably ought to go to the hospital. On the other hand, if you just feel like crap and your oxygen level's 98, odds are we're not going to put you in the hospital. We're probably going to say you're sick. It's like that old TV commercial that says, rest in bed, drink plenty of liquids, and take Tylenol. That hasn't changed.
Yeah. Well, we like I said earlier, I'm in fact I'm just going to send you a Happy New Year's text. I might even give you a call just so we can just totally just put away this whole thing of talking to Doc.
I'd love to do it.
Talking to Doc Vredis when there's something going on around here. So, nonetheless, Dr. James Vredis here with San Angelo Live on Ask San Angelo Live. Doctor, it's always a pleasure having a chat with you. Hopefully, the next time is not about another strain of variant. Crossing my fingers,
yes.
Knocking on wood.
Thank you, Manny.
Alrighty. For Dr. James Vredis, I'm Manny Diaz for San Angelo Live.